welcome to the final part of this amazing interview with Noam. Don't forget to like, subscribe, share, and of course comment. Enjoy the show. Speaking of which, we're obviously into week, what is it now, 11 or 10?
Yeah, 11, going into 12, I think.
Yeah, so we work with 2 semesters here at this university, for those that don't know, and there's about, 14 weeks per
14
semester,
weeks.
roughly. And then into week 13 and 14, we usually get like our end of semester credit tests, so to speak. I'm guessing you got a few coming up. So when's your first round of exams?
I'm already having them.
No way. And he's given us time. So
exactly. But I have another one next week,
Okay.
Slovak, and then the week after I have a bunch of stuff like internal medicine, surgery, and yeah, just a lot coming up, and then they still carry on into January sometimes, you know? So these are like the pre-terms, and then you can end up doing like proper exams in January if you have to. So it's good.
And then that break between both semesters is about a month and a half, I think?
The whole of January can be seen as a break, right? And then we start back in February.
Great stuff.
So yeah, it's good.
And then obviously you mentioned there Slovak. So I was one of those that used to be super scared about learning a new language. I know that it's compulsory here, but they do teach you quite well. What's your experiences been so far of Slovak, and any scared students out there that are like, I don't want to come here because I have to learn Slovak? Is it doable?
Look, take it from me, okay? I learned French for 5 years and I know nothing, okay? But I've learned Slovak for 1 year and I think I know quite a bit.
Oh, wow.
I think it's the environment as well.
Sure.
You're surrounded by Slovaks as well. You know, you go out, you make friends, and you try and speak Slovak to them, right? Even though your accent might not be good and they might laugh at you. But you still put in an effort, right?
Exactly.
The teachers here are pretty good. They're patient. That's a good thing. That's a good thing that you need from a teacher. And their English is good as well, so they're able to translate for you.
Yep.
Don't be afraid to make mistakes in the language. Like, no one is expecting you to know it completely. We're adults. It's harder to learn a new language at this age,
of course.
right? But 3 years of properly learning the language and putting time into it, you should be able to be fluent in your 4th year or something like that. Yeah,
You've heard it from the man himself,
exactly.
guys. So it can be done.
It's all about effort. It's all about effort,
for sure.
And then you also need to talk to your patients in Slovak. So even after your 2nd year, and your 3rd year, and your 4th year, you're forced to put your Slovak into use. So it's good.
That's perfect. Yeah. That's perfect. And then, I mean, I'm a bit of a sellout. Like I've not learnt the language too well, but then again, I've only been here for a couple of months.
Yeah.
I'm finding it quite easy to still go out any shops round town, ask for directions. Whatever. People are quite friendly, I'd say. They speak English in most cases. Yeah. Have your experiences been good? Have they been bad? How would you describe it?
Yeah, most of them speak English, as you said, especially the younger generation.
Yeah.
You won't find many young people who don't know how to speak English, right? Yep. And even if they don't, it's usually broken English. You still understand them quite a bit.
Yeah.
Even the older generation, it's usually like the adults, not the grandmas, the grandpas.
Yeah.
They don't know how to speak English. But even so, you'll be able to get around and you'll be able to ask for directions. They might reply to you in Slovak, but they'll give hand signals.
Yeah,
you know?
that works.
If they do this, it means 2 blocks. If they do this, 3 blocks.
Oh, I didn't know that.
Sometimes, you know, especially in Ukraine, they did that a lot.
Yeah,
so
for sure.
So yeah, it's pretty simple to interact with Slovaks, and they know that you're sometimes trying to speak the language as well.
Of course.
So they'll be patient as well.
I had a friend ask me a while back, it's like, it's an Eastern European country. Do you have much issue with like racism, for example? Now, me personally, thank God, it's been perfectly fine.
Yeah.
And I think that kind of stereotype of Eastern European countries having a population that like, hates anything that isn't white. I would say, fortunately, I've not come across that. But you've been here longer than I have. So how's it been for you?
Yeah, I can't say that I've had a racial moment.
Yep.
No, maybe you can feel that you're out of place. But that's normal wherever you're the minority. Of
course,
you know? And it's actually a lot of the time they're more interested than they are racist. They'll actually start a conversation up with you in the elevator. right?
Yeah.
Especially the old people, the
Sure.
grandmas and the grandpas. They'll start a conversation. They'll ask you where you're from in Slovak. So you need to know you're Slovak to have a conversation. And then you say, oh, I'm from England. But the thing is, they'll say, oh, but Africa. Where in Africa
You're not really from
You're
England.
not really from England. And that's, a lot of people will say, oh, that's racist. But no, it's not. Because
it's not, yeah.
obviously I'm African. So I understand they're more interested than they are racist.
Yeah.
Right? Of course, you get stares and you get people maybe rolling their eyes. But I think for the majority, they're very used to having international students
Yeah, they're quite
in
tolerant.
their city.
Definitely.
Huh?
They're very tolerant here. I
Yeah,
think.
they are.
Yeah.
They are, for
Quite
sure.
chill.
They're used to it. You have people from all over. And I guess we'll get into the diversity of the school later on.
Yeah,
So,
of course. I think like for me, when I was in Egypt, for example, where they're all the same color as I am, I'd have the same thing. They would ask me, "Where are you from?" And I'd say, "From England."
England.
They'd be like, "No, you're not." So anywhere in the world, I feel like maybe only in the UK is it okay to say, "Yeah, I'm from England." They'd be like, I get
exactly.
it, because it's so diverse.
Yeah.
But in Egypt, I had the same thing. They're like, "No, you're not. Where are you actually from?" Like, all right, cool. My parents are from Pakistan, for example. So I get it.
Nice.
So back to the medicine side of things, because obviously a lot of people want to know, where do we go from here? What are your plans post graduating? Obviously, you said you wanted to go back to Canada and go out there. Is it a case of specializing in something? Do you have any career goals? Like, how does it work for you?
Yeah, I want to specialize. Of course, you have to first do residency. And what I want to specialize in, people have been asking me this for years. I still don't fully know.
Right.
But that's the great thing about 5th year and 6th year, is that we do a lot of specialization courses, right? You're doing neurology or neuroscience or neurosurgery, and then you're also doing like cardiology, and you're also doing gynecology and stuff like that. So from there you get to see what you want to do, right? And so I'm going to use the next 2 years to really know what I want to do after.
Anything so far you don't want to do, like from your experience?
That's a good question. I don't think there's anything
Still
off
open.
my plate.
Still
Yeah, it's still
open.
open.
Okay.
Still open.
He's a humanitarian guy. So obviously, from that we can tell you're quite a helpful person. You're looking out for helping others.
For sure.
One of the things that people may not know is that you're currently running a platform for people to get a lot of help and assistance from. I myself have actually used this platform as well to help me with my studies as a student here, and I'm actually super grateful that this platform exists. I'm going to hand it over to you. Can you introduce what we're talking about, and then we'll start diving into it a bit more.
For sure. So what he's referring to is a website called Axxon, AXXON, okay, Axxon Mall. And I created this back in May this year, April, May, and I created it because when I first came, I realized that you can only get information if you know people.
Yeah.
So when I first came, I tried to get to know as much people as possible, as many people as possible. But I knew that if it was 18-year-old me, I would be alone.
Yeah,
I knew it.
exactly.
It was only because of my experiences that I was able to get a lot of contacts. So I was thinking, okay, is there a way to get all the information in one place? Because everything was scattered, right? We'll send things through WhatsApp, through Facebook, but nothing very solid, right? So I ended up creating a website where you can download a lot of these PDFs that are circulating around the school. But I also wanted to go one step further and see how people can even make money in university, right? And by doing that, I said that people who have medical school notes, they should be able to sell it to other medical students, right? I haven't made a section for dentistry students yet, but we pretty much have the same subjects for the first 3 years.
That's how I've found use in that, because of a lot of our subjects do coincide. Even in the 4th year, like we're currently doing some 4th year subjects.
Okay, like what?
Neurology, gynecology, all these things, right?
Okay.
So it's super helpful, but the dentistry thing will come. Right?
Exactly.
We definitely have to make that happen.
Yes.
But do carry on. Sorry.
No problem. And so I just created a website. I called it Axxon because of the
nerves and stuff.
nerve fibers. And it was a way of connecting two people, like connecting two,
Smart.
neurons, right? And it was connecting the seller and the buyer, right? The person who wants to download the PDF, the person who wants to give away a PDF, right? It was connecting two different parties together, right? And so it's been successful, especially in the first month. So many people were downloading PDFs. Even though they were circulating around the school, they at least knew that Axxon definitely had something that they were looking for.
Centralized, right? Yeah.
Exactly. So it's been very helpful. There are some things that are paid for and it's not expensive. Because I'm a student, I understand that no one wants to pay like 30 euros for a piece of PDF, right? For a PDF. So I just made it, I told the people, look, it's going to be 2 euros, no more than 5-6 euros, okay? And so we made it that it's 2 euros or so, depending on the quality, depending on how many pages there are, and depending on the demand as well. So 2 euros for chapters. The only ones that are 5 euros are when we accumulate chapters, right? So instead of downloading like 3 €2 chapters, you download a 5 euro chapter of everything together, right? So, but the ones that are free, which is quite a few of them, are the ones that we already have on our phones. It's just that maybe you don't know who to ask for it, so you go to Axxon. And yeah, it's something not run by the school, it's run by students. And it's been very helpful for a lot of people, actually. So
what kind of feedback have you got from people? Any good reviews, anything?
I've gotten some good reviews, actually. They said, as even you yourself, saying that it's very helpful, that they're able to download stuff. There's something called state exams that happens in 6th year. I added a section for people who have state exams. So they have triplet questions, and then they have explanations for the questions. And I put that on the website as well. So if you have state exams, there you go. There's a section for state exams as well. So there was another thing. I did get one negative review. Yeah, and it was actually about some handwritten work, right? But I actually made it clear that some people like handwritten work more than other people. So there's always something for you. Some people have typed things out, some people have written things out, and I've always shown a preview of the PDF before you download it. So if you look at the preview and you say, okay, that's a bit of me, I'll download it. There you go. If you don't want to, that's okay.
For sure. So, all right, sounds great.
That's how we got around the problem.
Yeah, that's perfect. I think, to come back to your initial point, it is one of those places that if you're not here from the start, like us, it can be a bit tricky because people have their little cliques, they have their groups, they share papers with each other, past papers, notes, all the rest of it. So Axxon Mall, especially for someone like myself, any newcomers or people that are not even at this uni can check it out and see for themselves. There is a whole plethora of different information of different subjects, and some of the handwritten notes are insane. There's one guy, one of your users,
Jerry's.
His notes is ridiculous, man. Like he's
Jerry's.
like an artist. Like
Honestly.
it's amazing work.
Honestly.
So definitely check him out.
For sure.
Shout out to him as well.
Yeah, for sure.
I think it's definitely a tool that will help more students. The more that know about it, the community will grow. There'll be more to download, and it will help everybody out. So let's keep adding to it. So off of that, is there any other things that we should look forward to, be it from Axxon Mall, any more services to provide, or anything else that you personally are looking to do as a venture moving forward while you're here, or is it just study now?
So for now, I think it's going to be just studies. That's what I want to concentrate on for my last 2 years, because States is no joke, right? You really need to study for those. But if I do have ventures, I'm definitely going to go through with it. And through these years, I've made a few friends, and I feel as if I'll do the venture with other people this time.
For sure.
So it'll be nice to leave a lot of things for the school, so people can end up carrying it on after I leave.
So you're looking to continue the website as a doctor in Canada somewhere, in your mansion, chilling out. Yeah, there you go.
Hopefully.
That is the plan.
For sure.
It's been an absolute pleasure having you on.
Thank you very much.
I'm pretty sure that the information provided today is going to be super helpful for anybody, whether they're coming to this uni, thinking about it, medicine, dentistry, whatever it might be. Studying abroad generally is not easy, and I think Elle's given us a nice breakdown as to the thought process of doing it in the first place, starting from fresh, whether it's transferring, not to be naive in doing so,
For sure.
but also at the same time not kicking yourself and just learning along the way, right? And then, I mean, look, it's a prime example that he's here, he's studying, and at the same time, he's helping others out, setting up websites. And I think that's something that, you know, is quite inspirational, I think, for people out there that, you know, don't ever kind of restrict yourself to say, there is a problem, I can't provide a solution for it. I think you've done a great job doing that. So once again, yeah, thank you so much for coming on.
Thank you very much.
And this is probably the first of many. So definitely catch you again soon, man. Thank you very much. And we'll see you on the next one. Take care. Bye-bye.